Friends, Namaste. I'm Dr. Murlidhar. I'm a vascular surgeon. As you know, this corona pandemic has engulfed the whole world, including India. The corona virus, when it affects a person, it produces the respiratory symptoms like the sneezing, cold, cough, sore throat, like that. When it extends into the lungs, it produces symptoms like pneumonia. And that is the time when the patient has to be taken care of in a ICU and may have to be put on a ventilator to maintain his oxygen levels in the blood. Now, people used to think it is always the pneumonia and which is not resolving because we don't have an antiviral which acts on this corona, and that's how we were losing a lot of patients. Now imagine if a research activity was carried out on the dead bodies of those who have died of corona to find out what is the cause for the death. The same thing has been done in Italy when two hospitals put together. They carried out post mortem examination on 70 dead bodies. They were surprised to know in many of these dead bodies it was not pneumonia which was the cause for death. They found that in the alveoli, it's like a air bubble which is in the lungs and which is the main area where the oxygen exchange takes place. Surrounding this alveoli, there are blood vessels, and all these blood vessels had clotted. The blood in these vessels had clotted. This was called as DIC, the disseminated intravascular coagulation, which as a result of the corona inflammation, and then this was the reason for the death of those patients. And then they realized why those patients were not put on medicines which will dissolve the clot. Then slowly they also analyzed some of the case papers where, due to many other reasons, the patients were put on anticoagulants like heparin or low molecular weight heparin, or even for that matter aspirin. Those patients surprisingly had less stay in the ICU and they had recovered. Then they slowly started thinking that clotting of blood is another cause of death in corona patients. It is not exactly all the time pneumonia. Pneumonia means accumulation of secretions within the alveoli, which when a patient is put on ventilator will not allow the air to go into the alveoli and hence oxygen cannot be maintained. But in those patients where the blood vessels within the alveolar membrane are clotted, they can be dissolved with medicines, and once they are dissolved, they may not require ventilation or they may require ventilation for a less period of time. So, lot of research is required in this disease. We should not be carried away by not finding a vaccine to fight this disease. On one hand, we have to find vaccine. On the other hand, we have to find a specific antiviral drug. Though you know now remdesivir is being used, but it is not very effective. But an effective antiviral on one side, vaccine on the other side, and if one can establish the accurate cause of death, if it is going to be DIC or clotting, then that has to be managed with drugs which dissolve the clot and which are simple drugs. And with that, if we were able to save a few thousand patients, it would have been very nice. So I sincerely advise our government to make post mortem of the dead bodies who have died from corona mandatory, so that research also starts along with treatment. Thank you.